Hair is said to be your crowning glory. It has a significant cosmetic factor. Hair loss is a disorder with adverse psychological effects, including low self-esteem with negative influence on social interactions. In this video, we will discuss reasons for hair loss and its treatments, both with conventional medicine and alternative remedies. Welcome to our channel, Doctor on 2. We are a group of dedicated medical professionals and researchers. We have painstakingly researched an up-to-date version of many treatments for hair loss in this video. If you want to know the correct treatment, it's important to know what is the real reason for that, so bear with me until the end of this video. There you will get a bonus, a recommended treatment for your baldness with high probability of effectiveness. Hair has a follicle that is attached to a capillary system for nutrients and oxygen. Also, growth factors reach the root of the hair to tell it to grow, so all the named growth factors are important for having a healthy hair. Hair grows in a cycle of 4 phases. The anagen phase is an active growing phase that lasts around 4 to 6 years, and after this phase hair follicle regresses because the hair follicle detaches from the papilla at the root. It means it detaches from the blood supply, so hairs get weaker at the roots and migrate upward. This phase is called catagen, which lasts about 2 weeks, and subsequent 3-month-long resting phase of growth called telogen phase. And at last, falling of hair called exogen phase. It happens because of the new hair pushes out the old one.
You normally lose between 50 to 100 scalp hairs each day because 85% of your hair is in active growing period, but only 15% are in the resting phase. Many baldness-like androgenic type occurs when the balance between growing hair and resting hair cycle is lost. It means shorter growing cycles. It results in smaller and shorter hair because the follicles don't get the needed time to grow, so hair gets smaller and thinner. This is called miniaturization. Either lack of growth hormones or dihydrotestosterone plays a major role in this process.
There are 2 major types of baldness, depending on if hair loss happens during the active growth phase or resting phase, it called anagen and telogen effluvium, respectively. We classify hair loss also by if it is which area it covers to focal or diffuse, or by scarring. If the cause of hair loss is from inflammation of hair follicles, it is called scarring, and non-scarring is resulting from other processes that slow hair growth without irreparably damaging the hair follicle. Alopecia areata is focal baldness, characterized by patches of non-scarring alopecia affecting scalp and body hair that can be psychologically devastating, especially in female patients. It is a chronic disorder secondary to the collapse of the immune system at the hair follicle, with a lifetime prevalence of about 2%. The most common cause of hair loss, which you almost encounter every day, is the hereditary alopecia, also called androgenetic baldness. The hormone dihydrotestosterone or DHT plays a major role. Together with other androgens, it shrinks hair follicles by shortening of growth cycle and causes miniaturization, as I mentioned before. It also make it take longer for your follicles to grow new hairs once old hairs fall out. It usually has no symptoms other than shedding. It increases with age, and it affects over 70% of men and 50% of all women over the age of 80. It is less likely in Chinese, Asian, and black people. In men, baldness begins at the temples or crown and can spread to nearly complete hair loss. Hair thinning in the frontal, parietal, and crown regions is typical of female pattern type. An interesting study has shown men with entirely bald heads were perceived to be more masculine, taller, dominant, and about 13% stronger than those with full heads of hair, according to this United States study conducted in 2012. Hair follicles are so sensitive to many stressors such as drugs like antimitotic chemotherapy, drugs for cancer therapy, anticoagulants, retinoids, anabolic steroids, oral contraceptives, ACE inhibitors for blood pressure, beta blockers for heart diseases. Also, lithium, and thyroid drugs, anticonvulsants, excessive use of vitamin A, toxins and heavy metal poisoning, and stressors such as radiation, pregnancy, and surgery. Factors like nutritional deficiencies like zinc, vitamin B7, or possibly iron deficiency can also result in temporary hair loss. Infections like secondary syphilis, many fungal infections, and also chronic autoimmune diseases like sarcoidosis, rare dermatologic conditions like dissecting cellulitis of the scalp, which most often affects young black men. Traction alopecia occurs when your hair is being pulled in the same way for a long time and subsequent strain on the hair follicles. They get pulled out strands and even get damaged. Wrong hair care practices and excessive use of braids, rollers, weaves, cornrows, tight buns, tight ponytails, and excessive use of hair dryers can contribute to traction alopecia. Treatment is coming up in a few minutes. Hair pulling disorder. Trichotillomania, also known as trich, is when someone cannot resist the urge to pull out their hair. It involves recurrent urges to pull out hair from scalp, eyebrows, and any other places. Many researchers believe it is a mental disorder. It is more common in teenagers and young adults. Earlier thought, wrong hair practices can result in CCCA, short for central centrifugal cicatricial alopecia, mostly seen in black women. It affects primarily the central part of the scalp, leading to permanent hair loss. The exact cause of this inflammation is unknown. Male pattern or female pattern baldness usually requires no testing. Hair loss in young men with no family history, use of drugs, anabolic steroids, or illicit drug must be tested. In women with evidence of virilization, blood levels of testosterone and dehydroepiandrosterone sulfate or DHEAS should be measured. When alopecia persists and diagnosis is in doubt, scalp biopsy from places of redness and inflammation should be taken. Fungal and bacterial cultures may be useful. One test that you can do at home is the pull test. Gentle pull about 40 hair on 3 different areas of the scalp. If you pull out less than 3 hairs, then the test is negative, but a test count over 4 to 6 hairs with each pull is positive and is suggestive of telogen effluvium, or resting phase hair loss. You can also do a simpler test, and that is to count of your lost hair for 14 days straight. Either during the first morning or during washing or combing. Collect them in clear plastic bags. Numbers of hairs is then counted in each bag. Lost hair, more than 100 per day, are abnormal, except after shampooing. Remember, in some people hair counts of up to 250 can be normal, but then again, they have no thinning processes on their scalp. When you see your doctor about hair loss, he or she can do a pluck test. It is done by pulling out about 50 individual hairs by their roots and then examined microscopically. Active growing hairs have sheaths at their roots. Resting hairs have tiny bulbs without sheaths. As I mentioned before, 85 to 90% of your hairs must be in active growth. But if this number is less than 80%, you can be suffering from an anagen hair loss, also called anagen effluvium. This knowledge can be used to know how your hair loss can be stopped. The main goals in treatment alopecia areata is to block the immune system attack and stimulate the regrowth of hair. Studies have shown topical corticosteroids improved regrowth of approximately 25% with the use of highly potent types. Also injection in bald areas with corticosteroids, and in severe cases, by using systemic drugs in the form of pills for extensive hair loss has shown effects but with different results. Minoxidil appears to be effective in the treatment of alopecia areata in patients with extensive disease 50 to 99% baldness. Response varies from 8 to 45%. Topical minoxidil are usually applied in combination with topical corticosteroid medications. Anthralin is a tar-like synthetic substance widely used for psoriasis, but it is a common form of treatment for alopecia areata too. It's applied once a day from 30 minutes to several hours depending of type and severity of the disease. Ultraviolet light (PUVA) is a controversial treatment that has been doubts of its real efficacy. Although narrowband ultraviolet B phototherapy is a well-established treatment in many dermatosis, there is little evidence of efficacy of this method for alopecia areata. Actually, some studies have indicated that UV radiation can speed up hair loss. For those who suffer from androgenetic alopecia, UVB oxidizes the hair's pigment cells, which is why your hair becomes lighter in the sun. UVA, on the other hand, can have a long-term effect on the integrity of your hair. Recent research has also shown that platelet-rich plasma therapy, or PRP, is effective at treating alopecia areata. A 2017 study in Italy also found male patients had increased hair improvement about 30% to 40% after 3 months. Janus kinase, or JAK inhibitors, used both systemically or topically. These drugs such as tofacitinib, or Xeljanz, and ruxolitinib, or Jakafi, are a new type of therapy being tested for alopecia areata. They are not approved by the FDA for alopecia areata yet and are only available right now in the form of an oral medication. Other topical immunotherapy is used to treat extensive alopecia areata, alopecia totalis, and alopecia universalis. Chemicals such as diphencyprenor (DPCP), dinitrochlorobenzene (DNCB), or squaric acid dibutylester or SADBE. Approximately 40% of patients treated with topical immunotherapy will regrow scalp hair after about 6 months of treatment. There are several therapies available for the treatment of androgenic alopecia, with 5-alpha reductase inhibitors and minoxidil most commonly used. We will discuss all the known conventional treatment for this condition one by one. Remember, the alternative therapies is coming up after conventional treatments. Minoxidil, 2% for women, 5% for men, works by mechanisms that are not completely understood. Only 30 to 40% of patients experience significant difference, but minoxidil is generally used for alopecia areata, as mentioned before. Regrowth can take 8 to 12 months. Finasteride inhibits the 5-alpha reductase enzyme, blocking conversion of testosterone to dihydrotestosterone, and is useful for male pattern hair loss. Finasteride 1 mg orally once a day. If it has effect, it will show before 6 to 8 months if one can tolerate side effects such decreased libido, gynecomastia, erectile and ejaculatory dysfunction, which may persist even after stopping of treatment. Dutasteride is a stronger inhibitor of 5-alpha reductase than finasteride and is sometimes used to treat androgenetic alopecia. Some hormonal modulators such as oral contraceptives or spironolactone may also be useful for female pattern hair loss. Low-level laser light therapy is an additional treatment for androgenetic alopecia, but its effect is still an active area of research. A 2019 study published in Lasers in Medical Science found that the laser therapy increased hair thickness and covered bald patches in both genders. Platelet-rich plasma is plasma from patient's own blood that has been separated from the other blood's components. It's stimulating hair growth because it contains growth factors. Treatment is done by direct injection into the scalp. Now, this section isn't just for androgenic type baldness, but almost any permanent hair loss can be treated surgically. Surgery is a fast solution for baldness which almost no other treatment can match up to. This includes follicle transplant. It is a surgical technique that removes hair follicles from one part of the body, called the donor site, to a balding part of the scalp, known as the recipient site. The technique is primarily used to treat male pattern baldness. Hair follicles are taken mostly from places that are more resistant to hair loss, like the back of the head. Donor hair can be harvested in 2 different ways. In FUT, a strip of skin is taken out, 1 cm wide and 15 to 25 cm long with linear suturing, and it heals with a linear scar. FUT is cheaper with a shorter operating time, but stitches are required with possible scarring. FUE is short for follicular unit extraction, also known as follicular transfer. It's transfer of groups of 1 to 4 follicular units by a small millimeter-sized needle for extracting follicular units from the donor site. In this method, no scarring is seen because it requires no stitching. It has a shorter recovery time of just 1 day with a shorter healing time, but it is more expensive with a long operating time and with multiple sessions required. Scalp flap surgery moves hair-bearing scalp to the bald area, providing instantaneous hair coverage. This transfer from one site to another is usually done in a series of procedures. Depending on which areas are needed, different techniques are used. The most known is rotation flaps, where one's the bald part surgically taken out and part with good hair coverage neighbor to that are cut and rotated in a procedure to fill the gap. It gives instantaneous coverage but with stitches and scarring. Scalp reduction or alopecia reduction is an excision of an area of alopecia. This technique are used for male pattern hair loss and also for cicatricial alopecia. It works best when used in combination with hair transplantation. Ideal candidates are males with Norwood grade 4, 5, and 6 who are above the age of 40 with stable hair loss. These patients should have little or no hair in the scalp but have dense hair on the sides and back of the head. Complication of this procedure is distortion of bald area, slot deformity, which is meeting of both the sutured edges in the midline with hair growing in opposite directions. It has been seen that alopecia reduction can accelerate baldness because of the fact that area of future baldness is stretched over a wider area in a younger patient. It can give both anagen and also telogen hair loss too, especially near the suture lines. Treatment for mentioned traction alopecia is to avoid tight hairstyles. If it is necessary for you to tie up your hair tightly because of your profession, you must try to wear your hair as loosely as possible and loosen up your hair whenever you can. Keep changing hairstyles every few weeks to prevent strain on one area of the scalp. It's also necessary to limit or avoid chemicals, including relaxers. Itching and scaling can be result from fungal infection, known as tinea capitis, and the treatment is oral antifungals like terbinafine and meconazole. It can be treated with topical over-the-counter treatments too. These come in the form of ointments, shampoos, or foams like ketoconazole, clotrimazole and iconazole. Trichotillomania is difficult to treat. It is a psychological behavior. Drugs that modify this behavior like lamipramine or a selective serotonin reuptake inhibitor like fluoxetine, fluvoxamine, paroxetine, sertraline, citalopram are of benefit. There is some new treatment that uses electronics like a smart bracelet that keeps one from unwanted behavior by making them aware via a vibration every time it registers that behavior. Although there is a lot of talk about its workability, most of them are individual experiences, but, until now, I haven't found any legitimate scientific research about the abilities of these products to treat triches. Central centrifugal cicatricial alopecia in black women or dissecting cellulitis of the scalp is best treated with an oral antibiotics tetracycline plus a potent topical corticosteroid. Hair loss due to chemotherapy is temporary and is best treated with a wig. After end treatment with chemotherapeutic drugs, hair regrows, but it may be different in color and texture from the original hair. The treatment of alopecia has a lack of sustained disease remission. Given the negative psychosocial impact of baldness, patients that don't see significant hair restoration with conventional therapies often turn to complementary and alternative medicine, also known as CAM. There are a variety CAMs on the market for alopecia, however, only a few are backed by strong scientific and clinical evidence. Natural products do not require FDA approval. The 2012 National Health Interview Survey reports natural products to be the most popular CAM approach for dermatologic conditions, used by 18% of Americans. In the next few minutes we will discuss alternative remedies for different types of alopecia. Some vitamins are often glamorized as a treatment for hair loss, but evidence are inconclusive. Some studies pointed to vitamin B7, vitamin D, vitamin E derivatives, calcium, iron and zinc has effects on having a healthy hair. Deficiency of vitamin D is a risk factor for developing alopecia areata, and that a significant number of patients with this condition had low levels of vitamin D. Deficiency of zinc can result in growth retardation, delayed puberty and alopecia. 50 mg zinc supplement shown to be beneficial for treatment of alopecia areata. Procyanidins are a class of flavonoids found mainly in plants, including apples, barley, cocoa, cinnamon, grapes, and green tea, described to have antioxidant, anti-inflammatory and antifungal capabilities. It is demonstrated to be one of the most effective and safest natural compounds in promoting hair growth both in vitro and in humans by topical applications. Topical 1% procyanidin B2 and 400 mg of its oral compound was investigated separately in a double-blinded, randomized clinical trial in patients with androgenic alopecia. It demonstrated increased hair density by 110 to 125%. Components from sharks and mollusks have been produced for many years as an enhancer of hair growth. A Scandinavian research in Inuit peoples shown healthy skin and hair to be a result of their fish and protein-rich diet. Originally marketed as hair gain and later Viviscal thought to increase hair shaft diameter and decrease hair loss. One study has shown taking orally marine protein supplement or MPS 3 times daily in 100 females for 6 months demonstrated a significant increase in the mean hair diameter as well as a reduction in shedding. Also, amino acids cysteine and lysine in the proteins have been evaluated in humans. Cysteine is important for making protein in nails, skin, and hair. It is also important for making collagen and thereby affect skin elasticity and texture. Chickpeas, couscous, eggs, lentils, oats, turkey, and walnuts are good sources of getting cysteine through your diet. Taking 70 mg oral L-cysteine with retinol in combination with histidine, copper, and zinc, resulting in a significant change in total hair count after 50 weeks in patients with androgenic alopecia. Lysine is an essential amino acid found in meat and eggs and is thought to play a role in the absorption of iron and hair growth. Transforming growth factor or TGF-beta1 inhibits hair growth. Unfortunately, testosterone increases expression of this factor, but caffeine can downregulate this expression. Besides, it also increases the expression of a very known hair growth promoter called IGF-1, short for insulin-like growth factor 1. 6 months of daily caffeine shampoo use resulted in a reduced speed of hair loss progression. Caffeine lotion has also been tested with similar results. However, studies are limited by a lack of standardized scientific evaluation.
Capsaicin is an active component of chili peppers. It is a chemical irritant and produces a sensation of burning in any tissue with which it comes into contact. Pure capsaicin is a hydrophobic, colorless, highly pungent, crystalline to waxy solid compound. Oral capsaicin 6 mg plus isoflavin 75 mg daily for 5 months increased mentioned hair growth promoter factor IGF-1, so it can be used to treat patients with androgenic hair loss and alopecia areata. In androgenic hair loss specifically, 88% observed hair growth following treatment. You can also apply capsaicin cream daily to affected scalp. It has been seen good effect in patients with alopecia areata after 3 weeks.
The use of garlic is an excellent idea for all-around health and wellness. It is rich in vitamins and minerals that are essential promoters of growth. Either topically or in your diet, it can stimulate hair roots. Also, sulfur in garlic is essential for making keratin, a protein that aids growth of hair. Furthermore, massaging your scalp with garlic oil is said to strengthen your hair follicles. We do know that garlic has beneficial effects on the circulatory system, and this can be good for improving blood supply to the scalp. And we also know that garlic's antimicrobial action helps kill yeast, and this can combat chronic inflammation. So while the exact mechanisms are unknown, there is still a lot to suggest that its use can be beneficial. By applying pure aloe vera gel to your scalp few times per week should stimulate the root of your hairs because it is rich in proteolytic enzymes that heal and repair damaged cells, therefore, it should improve the health of follicles and boosts growth. Aloe vera also stimulates the dormant follicles and thereby regrowth. Coconut oil contains fatty acids that penetrate inside the hair shaft and reduce protein loss from hair. Unfortunately, there's no scientific evidence to show that it has any effect on preventing androgenic baldness. However, this hasn't stopped people from making claims about coconut oil's power to promoting hair growth, but it's been shown to improve the health and luster of hair. It is also thought to have antifungal properties. Evidence of omega fatty acids' impact on hair health is limited, but a research published in March 2015 in the Journal of Cosmetic Dermatology has shown taking a mix of omega-3 and omega-6 supplements along with antioxidants acts efficiently against hair loss and improves hair density. Substance called ginsenoside in red Korean ginseng is said to stimulate hair growth. Its effect is done by preventing cell death of hair follicle cells and inhibiting 5-alpha reductase effects on follicles. Empty 2 capsules of red Korean ginseng into a bowl. Add 1 tablespoon carrier oil and mix it thoroughly. Apply it on the areas of thinning hair by gently massaging the mixture into your scalp for 5 minutes. And let it rest for at least 35. The effectiveness of topical crude onion juice in the treatment of focal hair loss compared to tap water was evaluated in 62 patients. After 8 weeks, 87% of patients treated with onion juice showed full hair regrowth versus 13% using placebo. Onion juice has been shown to successfully treat patchy alopecia areata by promoting hair growth. It is also thought to improve circulation. Blend a few onions and squeeze out the juice. Apply the juice to your scalp and hair and leave in for at least 15 minutes 2 times daily. Although the mechanism of topical onion juice is unknown, it is thought that sulfur and phenolic compounds cause a contact dermatitis, stimulating hair regrowth through antigenic competition.
Rosemary oil appeared to be a safe non-prescription alternative for androgenic baldness. It is an aromatic evergreen herb with antioxidant, antibacterial, antifungal, and anti-inflammatory properties. It also enhances microcapillary perfusion and stimulates new hair growth. Mix a few drops of rosemary oil into a carrier oil like jojoba and massage it into your scalp before washing. Do this a few times per week. You can also add a few drops of rosemary oil into your shampoo on a daily basis. Geranium is a genus of 422 species of annual, biennial, and perennial plants that are commonly known as geraniums or cranesbills. They are found throughout the temperate regions of the world and the mountains of the tropics, but mostly in the eastern part of the Mediterranean region. There is scientific data indicating that geranium oil may be beneficial for a number of conditions, such as anxiety, depression, infection, and pain management. It's thought to have antibacterial, antioxidant, and anti-inflammatory properties. You can use geranium oil to promote hair growth by mixing a few drops into a carrier oil and use it to make a hair mask, or add it to your daily shampoo and conditioner. Since geranium balances secretions around the hair follicles, it's an effective agent for hair growth. While there isn't much research on geranium's effects on hair, a 2017 study published in BMC Complementary and Alternative Medicine found it did promote hair growth. Lemons contain lots of vitamin C, which boosts collagen production. Besides that, it contains many other nutrients such as antioxidants which strengthen the hair follicles, therefore it encourages even dormant hair to grow. You can use fresh lemon juice or its oil. Apply fresh lemon juice to your scalp and hair 15 minutes before you shampoo. It's shown lemon essential oil diluted in a carrier oil works faster. Melatonin is a neurohormone secreted by the pineal gland that regulates mammalian circadian rhythm. Usually individuals who take melatonin do so to treat sleep issues and take supplements in the form of pills. But recently, scientists have started using melatonin topically to research the effect it may have on hair health. 5 clinical studies showed positive effects of a topical melatonin solution in the treatment of androgenic alopecia in men and women while showing good tolerability. Other studies has shown significant reduction in baldness was observed in women while in men remained constant. Overall, after treatment with melatonin, patients with diffuse alopecia had a significant increase in active growing hair at the occipital versus the frontal hairline.
Pumpkin is a member of the squash family native to North America. Pumpkin seed oil contains phytosterols known to inhibit 5-alpha reductase, preventing testosterone to active dihydrotestosterone. In addition, this study showed that this seeds is a promising treatment for androgenic involving the vertex but failed to address the supplement's effect on frontal variants. If you are not interested in using finasteride, you can use saw palmetto. It is an extract from the berries of the saw palmetto palm tree. American dwarf tree is a competitive inhibitor of both forms of 5-alpha reductase and 3-alpha hydroxysteroid dehydrogenase activity, increasing the conversion of dihydrotestosterone to its weaker metabolite, androstenediol. As a result, the pharmacodynamic profile of saw palmetto differs from finasteride due to multiple sites of action. It's recommended to use it topically than orally for treatment of androgenic hair loss. It is thought that acupuncture can increase circulation, stimulate hair follicles, and decrease inflammation. 78 patients were treated with either plum blossom acupuncture of the alopecia areata or topical 2% minoxidil daily, with total hair regrowth in 58% of acupuncture patients versus 34% of minoxidil patients, although additional scientific studies are necessary to clarify results. If you Google it, you will find out that there are different recommendations for using eggs for your hair loss. Some say you should just use egg yolk and others mean egg white has promises. But it should be noted that egg yolks contain vitamins A, D, E, and K, along with omega-3 fats, compared to the whites, which are rich in protein, sulfur, phosphorus, selenium, iodine, and zinc, all of which are important for preventing hair loss. So to endorse just egg yolk or egg white has no scientific or logical reasoning to it. Instead, we suggest a mask of 1 whole egg, mix with a teaspoon of olive oil and honey for applying to your scalp and hair. Rinse after 20 minutes with a mild shampoo.
Licorice root considered one of the world's oldest herbal remedies. It is also one of the highly recommended treatments for hair loss. It is believed that pores of the scalp open up due to its mollifying properties and reduce irritation and redness resulting in hair growth. Although scientific research about its potency to help grow dormant hair are limited. Make a paste by adding a tablespoon of ground licorice root and a 1/4 teaspoon saffron to 1 cup of milk. Apply this to your scalp and leave it on overnight. Wash it next morning. Do this twice weekly.
Although there has been a lot of research around green tea and the possible health effects of drinking the tea regularly, there is little evidence that drinking it has any effects on your hair. There is discussion around how it can actually stop hair loss. It is believed that the catechins found in the tea had 5-alpha reductase inhibiting properties. But always question asked, does the tea repress dihydrotestosterone and stop shedding? Or does it simply aid hair growth? Now, recent studies have suggested green tea's anti-inflammatory properties are linked to hair growth. Study with mice showed hair loss slowed down in all mice who received the tea in their drinking water. It was found that the green tea even triggered new hair growth. Soak 2-3 or more tea bags depending of your hair length in 1-2 cups of hot water. When it cools, pour this over your scalp and hair while gently massaging your head and rinse with cool water after an hour. There are a great number of people who recommend beetroot juice for stopping shedding hair, but more research is necessary for a comprehensive and reliable assessment of the positive effects of beetroot juice. Beetroot is rich in carotenoids, vitamins C, phosphorus, calcium, vitamin B, folate, manganese, betaine, and potassium. It's also rich in lycopene, make it an extremely effective dehydrotestosterone-blocking food. Make a paste by mixing 7 to 8 boiled beetroot leaves with an entire beetroot, 2 teaspoons of henna powder and a teaspoon of coconut oil. Apply this paste on your scalp and leave for 15 to 20 minutes before rinsing with warm water. Greek yogurt are rich with riboflavin, niacin, calcium, choline, iodine, and lots of protein, vitamins B12, B7, and B5, ingredients that helps with blood flow to your scalp and hair growth. The lactic acid in yogurt helps to hydrate the hair and helps to clear away dead skin cells. It's recommended to use it as a mask, especially when it used with 1 or 2 tablespoons honey and lemon once or twice a week. Fenugreek is an herb native to southern Europe, the Mediterranean, and Western Asia. It looks similar to clover and has seeds that taste and smell like maple syrup. In Ayurvedic and Chinese medicine, fenugreek has been used to boost digestion, induce labor, for easing menstrual cramps, diabetes, promoting milk production for breastfeeding, and to promote hair growth. Some early research has shown that fenugreek seeds can treat low to moderate hair loss in men and women. It may stimulate blood circulation or may interact with dihydrotestosterone, although more studies, especially human studies, are needed to determine if and how fenugreek can help grow hair. Indian gooseberry or amla, beside being rich in vitamin C, iron and calcium, antioxidants, it has anti-inflammatory and exfoliating properties. Amla helps promote faster growth of hair, prevents premature graying, but most of the reported health benefits of amla oil have not been scientifically proven. A 2012 study found that amla oil was a powerful inhibitor of 5-alpha reductase. Massage to your scalp and hair a paste of amla powder and lime juice, and keep it moist for an hour before rinsing with normal water. Your everyday diet is important for your general health. Iron deficiency can cause of hair fall. Diet that includes spinach and oats can compensate for that. They are not only a great source of iron but also vitamins. Nuts, like walnuts, contain biotin, vitamins B1, B6, and B9, vitamin E, plenty of protein and magnesium, all of which strengthen hair cuticles and nourish the scalp. Lentils are a great source of protein, iron, zinc, and biotin and folic acid, all which is necessary for restoring the health of red blood cells that supply the skin and scalp with much needed oxygen. Strawberries, rice, onion, cabbage, cucumber, and cauliflower contain high levels of silica. It's a trace mineral vital for hair strength and hair growth. Guava is also rich of vitamin C, which prevents hair from becoming brittle and breaking. Yogurt is packed with vitamin B5 and vitamin D that are known to promote hair follicle health. In general, orange-colored fruits and vegetables such as carrots, sweet potatoes, pumpkin, cantaloupe, mangoes are a great source of beta-carotene and vitamin A that protects against dry, dull hair and stimulates the glands in your scalp to make an oily fluid called sebum. Stress can disrupt the process of hair growth and lead to premature graying. Try to avoid stress. Also, hot showers dehydrate hair and strips the scalp of its natural oils, leading to dry, brittle hair that's more prone to breakage. At last, avoid combing your wet hair because they are never more fragile and prone to breakage when wet. Unfortunately, there hasn't been found an ultimate cure for baldness, so all mentioned remedies must be used in a lifetime. I suggest you talk first of all with your doctor, and if there isn't any conventional treatment to your satisfaction, Try one or two of these home remedies, but don't be disappointed if some of them didn't work as you anticipated. Comb through all remedies and find one that works for you. One mask that we have seen it working for strengthening your hair is that if you blend 200 milliliters of aloe vera gel, 50 milliliters of coconut oil, 5 vitamin E standard capsules, 5 vitamin B7 capsules, if possible 5 Persyanodin standard capsules, and 4 capsules of red Korean ginseng. Blend 10 to 20 milliliters of this cocktail with a tablespoon of yogurt prior to using it and massage it on your scalp 3 times per week for 10 consecutive weeks. We hope you got what you came for. Our goal is to educate everyday people to a degree that they can choose a treatment for themselves and help others in need. So until the next video.